All right, welcome. Week 2 of Pelvic Health Essentials. This is Hillary, and this week we are talking about a topic that is really what made me start this course. Through the process of me learning more about healing my own pelvic floor, my own diastasis, I was like floored, no pun intended, as a pelvic floor therapist, and then as an occupational therapist background, like, why are we not learning about any of this stuff? I never knew as an OT about a lot of what I'm teaching you today. And I'm someone who is in healthcare and felt fairly knowledgeable. And it's really so basic. And I think it's something that all moms should be learning about, really all women should be learning about. So this week is a topic that's really near and dear to my heart. So it's how breath and posture relate and influence your pelvic floor and pelvic health. So I'm going to share my screen. And okay, let's see, let's get organized for a second. My computer, okay, my computer's fan is going, meaning it's a little overwhelmed at the moment. So hopefully this goes smoothly. Okay, so pelvic health essentials, scoot on in here. Week 2, breath and posture for your core and pelvic floor. So by the end of today and over the course of the next week, as you're working on incorporating these things into your day-to-day, I hope what you get out of this is that you're understanding the link between your breath and your pelvic floor. You're understanding how abdominal pressure or intra-abdominal pressure influences your pelvic floor. Common breathing pattern errors, how you can begin to improve them, but more importantly, identify that you have it, that you're doing one of these errors. And once you identify it, then you're more able to correct it. How to engage and restore your deep core through breathing. A lot of the breaths that we're going to practice today and learn today are what I recommend moms doing from very early on postpartum. Postural alignment and its role in pelvic health, and then gaining awareness of your breathing and pelvic floor relationship. I'm going to take you through a guided body awareness exercise. And I'm going to talk a little bit about Kegels today, and it'll probably come up again in the next couple of weeks, but this will be probably the most. I'm going to dive into Kegels and how to do them, who should do them, why, and how. All right, let's dive in. So starting with this concept, kind of taking it up to broader level in saying your 3 diaphragms. You might be thinking, what the heck are you talking about? So diaphragm is a dome-shaped muscular partition. We, of course, have our breathing diaphragm, and that's the one that most people think of when we say diaphragm or breathing diaphragm or your diaphragmatic breathing muscle. That's what we think of. But there is a link between your throat musculature, your larynx, your breathing diaphragm, and your pelvic floor that relate to pressure balance and movement in your body, making it more successful and fluid and natural, or not as successful and out of line and not working well. So of course, up top, the reason we can kind of still classify this as a diaphragm is it really separates the entering into your body from the internal body. There is like your epiglottis that moves and opens to make sure air gets the right way and food gets the right way. So it's the entrance to the body, and there is our partition separating the airflow and the food. Your breathing diaphragm separates the lower and upper thorax, the upper organs, lower organs, and of course assists with breathing. That's its primary role. And then your pelvic floor, this is kind of a review from last week, but the group of 14 muscles arranged in a bowl-like, so it's the opposite. So our throat is more domed this way, the diaphragm's domed this way, although it moves a lot, and then the pelvic floor is domed opposite And it separates our organs from the external world in more the exit route. You know, it assists with elimination, but also protects. It's strong, it's flexible. All of these diaphragms are strong and flexible, and that's really important that they are strong and are maintaining their strength while also maintaining their flexibility. When we lose flexibility or strength in any of these, the whole system gets a little bit or very much out of alignment. Now we're going to be focusing more on the relationship between the breathing diaphragm and the pelvic floor. But I want to start with a relaxation of your jaw. And Sarah, even though you're in the car, you can still do this. Super easy. Just don't close your eyes. So I want you to, if you're somewhere safe, start by closing your eyes. So when we relax our jaw or tune into how our jaw is feeling, it directly impacts our pelvic floor. So if we have type, maybe went through some of those screenings or the symptom check or function check last week, and you're like, I might have some things going on. And one of them could be tightness. Well, doing routine checks of your jaw tightness can help the tightness and hypertonicity in your pelvic floor diminish. So the process of this jaw relaxation, I think it's great to close your eyes, but don't do that if you're somewhere you shouldn't be doing that. But closing your eyes, and then you're going to close your lips and begin breathing through your nose. And before we go on to step 2, I want you to just tune into how your jaw is feeling. Is there tension there? Is there tightness? Is there pain? Is there stiffness? Or is it not giving you much feedback? You can touch it with your fingers if that's helpful. Sometimes when you touch it, you're like, oh, there is a lot of tightness there, and you kind of want to keep massaging it. So take your fingers away, but now you're aware there is some tightness there. Keeping your lips closed, continuing to breathe through your nose. Now lower your tongue to the bottom of your mouth. Make sure it's not pressing up in the top of your mouth. Keep your teeth separated, but very gentle. Not opening your mouth, not straining the jaw in any way, just parted teeth. And then the musculature in your throat, notice that you can either close it and kind of rub the back of your tongue on the top of your mouth, top of your throat, or you can open it. I want you to keep it open. And by taking those 4 steps of closing your lips, lowering your tongue, keeping your teeth gently separated, and opening your throat, it relaxes the jaw muscles, helps them take a break. And if you are tuned into your pelvic floor, which hopefully by the end of today, you're a little more aware of that, you may notice some reduced tension in your pelvic floor. You may even notice an increased ability to take a deeper breath when and feeling like you're filling your diaphragm or using your diaphragm more, breathing diaphragm, as you go through this. Okay, so this is a relaxation I give any of my clients who have high tone or tightness or pain in their pelvic floor, because they can do it anytime, anywhere, and they're influencing their pelvic floor, but they're also helping their jaw. All right. So let's get into the meat of today. Go right to it. So diaphragm and pelvic floor. So when we inhale, our diaphragm lowers and our pelvic floor softens. It lowers, but it lowers in a different way. So I don't want you to think about your diaphragm and your pelvic floor as being the same size, moving in exactly the same ways, because they don't, but they do mirror each other. So your diaphragm is a much bigger and powerful, in a different way, muscle, and the pelvic floor, again, is a group of muscles. Their movement with your breath is much more subtle, the muscles of the pelvic floor. Now, when you exhale, the opposite happens. Your diaphragm lifts to help push air out of your lungs, and your pelvic floor should rise a little bit. It doesn't contract. That would be not right to think that way. It doesn't do a Kegel. We're not walking around doing Kegels all day, but it does rise. Okay, so inhalation, diaphragm lowers, pelvic floor softens. Exhalation, your diaphragm lifts and your pelvic floor rises. Intra-abdominal pressure. So as these actions occur with your breathing pattern, inhalation, the pressure rises. So we inhale, if you take a big inhale right now and hold it, it's like you're gonna pop, right? There's more pressure. Holding your air in your body raises the pressure of your intra-abdominal space or your abdomen. The diaphragm's pushing down on those organs. The pelvic floor, therefore, because of that increased pressure, goes, I'm going to give a little. Just so there's not too much pressure. I'm going to give a little to that pressure. So it softens downwards, or it should soften downwards. And then with the exhalation, the pressure lowers because there's less stuff in our body. There's less pushing the oxygen out, makes space. And so the muscular tension increases. When we exhale, we use our diaphragm primarily, but we also use abdominal muscles to help with exhalation. So it's muscular tension is the pressure then. So what benefits does this pressure system have? It's stability for movement. So when we're moving, we need to keep breathing through the day, but there needs to be enough pressure and stability to do those movements without being floppy, without feeling weak or incoordination happening. So when we inhale, it's this pressure that happens. And of course, there's muscles supporting. There's always muscles activating. We have lots of support muscles, but there's this pressure increase that provides some more stability. And then when we exhale, it's the abdominal muscles are more part of that action, helping keep the core stable. It also provides support for the organs. So by maintaining steady and stable pressure through this breathing cycle, organs don't need to rely on their own integrity to receive support. So if you're not getting that when we exhale, you're not getting a little lift and activation of the abdominals, there is not as much support around our organs, and they kind of have to hang on more, or they don't, and gravity starts impacting them and they can shift and move. And this is what prolapse is. So prolapse, anyone with a prolapse of any degree should have education about this pressure system and understanding the need for a strong core, the need for an imbalanced pressure breath system that's not confused. And I'm going to get into how that can happen. How can this all go wrong? So one of the big ways that this goes wrong is during pregnancy. So it's put simply, when we're pregnant, the sensation feedback we're getting from our body to our brain is just different. It's not the same information. We have this giant belly and we have to adapt to the physics dynamics of balancing that belly. So we do some funky things, some productive and good, but sometimes not productive and building kind of bad habits. But we do it so we're stable. The body is going to do what it needs to do to protect itself, whether it's ideal or not. And we don't always, after the pregnant belly's gone, we don't always just flip right back to what is natural and habitual and correct. Sometimes these system things need to be relearned. And if you don't even know that there's a pressure system to relearn about, or a breathing pattern that links with your pelvic floor to relearn about, how can you correct it? Right? So we're going to be really talking about this today, what can go wrong in pregnancy, and then how to start identifying it and how to fix it. Exercise is another one. So here, just real quick, you line up pregnancy, things didn't get relearned, and now you go back 3-4 months later to your favorite workout of long distance running or CrossFit or whatever it might be. And these systems aren't in sync. You are likely to have an injury or impact your pelvic floor health just because you don't know about this. Not because you're doing anything wrong, it's more not knowing how to approach it correctly. So exercise, even without childbirth though, heavy, intense exercise challenges the system and can lead to dysfunction over time. We're going to talk more about that as well. So these are the two most common errors as we start to get this, what's called a paradoxical breathing pattern. It's basically when instead of those circles going in the same direction, reverse. So your diaphragm's going up, pelvic floor is going down. Diaphragm's going down, pelvic floor is going up. They work in opposition, and this isn't helpful. And then we also see shallow breathing patterns. So where you're using, instead of your primary breathing muscles, which we'll go over, you're using more of your accessory breathing muscles. And this is not an ideal way to be breathing either. And those two things can be combined. All right. So pregnancy's impact on breathing. So it impacts our diaphragm. Baby is smushing our diaphragm up, especially if you have a bigger baby or you're smaller framed. You may feel a baby kicking into your ribs. If your baby's kicking your ribs, it's hitting your diaphragm. It can cause the areas of your diaphragm to simply not to work as well. It doesn't mean you can't breathe. Remember, we have other muscles that help with breathing. You can have an almost completely paralyzed diaphragm and still breathe. So it doesn't mean that. You're still able to breathe, but what starts to happen is you usually develop more of a shallow breathing pattern. And then after birth, that doesn't automatically return. You may not realize that you developed that shallow breathing pattern and you just keep doing it. With your pelvic floor, of course, it's holding the weight the whole time. It tends to become through, especially with vaginal birth, it has to stretch and then it might go back and be kind of pissed off. I think we talked about that last week, and tightens up, can cause pain. And now it's not moving with that breathing pattern. So your diaphragm's doing all its job, but the pelvic floor is just like, nah, I'm not gonna move anymore. I don't wanna be flexible and buoyant. I just wanna hold. And abdominals, we kind of lose that keen proprioceptive connection. So proprioception is your conscious awareness of where you are in space without looking. So right now I know that my feet are crossed, even though I can't see them. That's proprioception. Or the feeling of engaging your core. You don't engage your core in the same way when you're pregnant as when you're not pregnant. And so you start to kind of that connection of what it feels like can be not as clear for women in postpartum. Like, I don't even know how to engage my core anymore. I don't know how to get it feeling strong again. So some retraining there is helpful, and breath is one of the best ways because it's more automatic than doing exercises. Okay, exercises impact on the pressure system. So high intensity exercise, it just adds more pressure to the intra-abdominal space and pelvic floor. Because you're breathing heavier, there's impact. You're trying to lift really big weight. So if you're familiar with a Valsalva maneuver, that is when commonly used in heavy weightlifting, purposefully, where heavy weightlifters will kind of bulge their abdomen outward to get that added pressure. And their core is really engaged, but they're bulging outward to get muscle engagement and pressure on their side so that they can lift something really heavy. But imagine all that buildup of pressure. What's going to happen? Well, you're at more risk for hernias, pelvic floor problems like incontinence and prolapse, and muscle injuries. So muscles just can't withstand that force. So protection, now take it back 10 notches. I mean, assuming you're not wanting to return to whatever crazy weightlifting right away, I think most moms know that's not appropriate or safe for a good period of time after having children. But if you want to return to a CrossFit class or you want to do a HIIT session, these 7-minute workouts are pretty intense. To protect yourself, you need good strength, coordination, and awareness of how the system works. We're going to go into more specific examples in week 5, but this is the introduction to that concept of why just going back to exercise is great, but needs to be approached with a more informed and conscious way of how to protect your body and knowing where the common weak points are. And this is one of the big ones. The common weak points are, if we go back to the last slide, a disconnection with your breathing pattern. The pelvic floor might be tight or really weak, and your abdominals are likely you're not as in tune with what they're doing, putting you at risk for with high intensity, causing an injury, or causing pelvic floor problems that were not there at birth. Okay, so paradoxical breathing pattern. I tried to get a video in here, but I don't think this link is working. The reason I popped a video in is I do not have a paradoxical breathing pattern, and sometimes I have trouble demonstrating it. I will demonstrate it when we go out of the share mode so you can see more clearly. But basically what it is, just like I explained, so the circles, as you can see, are going in opposition to each other instead of in the same direction. So the common signs are that the rib cage elevates with the inhale, but the abdomen doesn't. So I think when we breathe in, there's an increased pressure. But if the abdomen is holding tight, where does that pressure go? Okay, so it goes up or it goes down, pushing more on the pelvic floor or getting you breathing more into your chest through that shallow breathing pattern. And then sometimes the abdomen may protrude with the exhale, when it's actually, when we exhale, we're supposed to have muscle abdominal engagement. But the abdomen may protrude slightly. It's usually not a big protrusion, but it's a sign that you're actually getting pressure or bracing in a maladaptive way. And also you often see some more neck tension. Okay, so with the inhale in this paradoxical breathing pattern, you just are getting way more pressure because the pelvic floor is lifting and you already have pressure there. The pelvic floor should be giving. This can happen without you really even noticing it, because it can also result from that pelvic floor just being kind of frozen. It's not going to be to the same degree, but it's not giving either. Okay, so reason why hypertonic pelvic floor can cause problems over the long term. It usually isn't going to cause a problem overnight, but over years and years of this, it can be problematic. And then exhale, you lose pressure and there's not as much muscle engagement, which is why sometimes you see this protrusion out of the abdomen. It's like the body's just trying to recruit whatever it can so that you're not all floppy and can hold yourself up and coordinate movement through breathing. Now you can go in and out of a paradoxical breathing pattern. It doesn't mean you're always here. Oftentimes it will arise with certain exercises in certain positions. Where like laying down, you're totally fine, but then you do sit up and do, I'm at a loss for an example at the moment, but you sit up and it returns. So it can be position or movement dependent. Doesn't mean you're always here. So take some keen observation when it gets a little more complex like that. All right, so I think this is good to know and understand is a little anatomy, but when we inhale, the primary muscles being used are the diaphragm and the intercostals. So the intercostals are the muscles between your ribs that help your ribs expand. So you inhale, these little muscles push your ribs apart and it actually helps that flare of the ribs. And the diaphragm drops down. Okay, it actually kind of relaxes, but it is contracting. The diaphragm contracts both downward and upward. It's a very cool muscle. And then these little intercostal muscles are pushing apart. But the other muscles working in here are your SCM, so sternocleidomastoids in your neck. It's a really big, strong lateral stabilizer of our neck. But you can use this muscle to help with breathing and your pec minor. With exhalation, and that's not It's not wrong to use the accessory muscles. They are being used with your breath. They help with every breath we take. So I'm breathing right now. I'm using those muscles, but the most effort is coming from my diaphragm and intercostals. Exhalation is same, diaphragm, intercostals, but the accessory to help get that air out, diaphragm lifts, intercostals come in and help contract up, and then your abdominals also engage, and your quadratus lumborum is a band-shaped muscle right here. It's also helping, so just kind of compressing and lifting. Okay, let's see. Let's see what accessory muscle tension with breathing. I just couldn't see what the top of that slide said. So you can see this gorgeous picture, but all this tension around my neck. This is one of the first signs I look for. I'll ask clients, okay, just take a deep breath in for me. And I'm usually looking right at their neck first. It's the first indication that someone's got a shallow breathing pattern. As they inhale, I also will look at what's happening with their shoulders and chest. Is there a lot of movement here? And I don't see any movement with their abdomen. That's a good indicator that they're using a shallow breathing pattern. So when breathing is shallow, you use the accessory muscles. We just went over that. So there's much more use of the sternocleidomastoid and the pec minor. And for exhale, you might be using a lot more abdominals than is necessary. Breathing should primarily come from diaphragm. This is very repetitive, excuse me. But the other thing that starts to be a problem with this breathing pattern is it's more of a fight, flight, stress response breathing pattern than a parasympathetic rest, calm breathing pattern. So if you're routinely breathing in through your chest, and think about this in the context of pregnancy and then going in towards labor, if you're walking around the last few weeks of pregnancy because you're so uncomfortable and you have that baby just pushing up on you, and so you're just like, well, I'm just going to breathe up here, probably not consciously doing that. Your body is just doing that because it's the most comfortable way to breathe. You're actually more activating your sympathetic nervous system. And we know with birth is going to go more smoothly the calmer we are. So deeper diaphragmatic breathing, some of the other breathing exercises I go through today are really going to be helpful in promoting a smoother birth, because your body, you're promoting through your breath that you use most of the day activation of that calmer parasympathetic nervous system. So that's the fix, just trying to start doing more diaphragmatic breathing. When I see a client, most of my clients will have a shallow breathing pattern to some degree. I'm just like, okay, we just need to get that breath deeper. And the cue I love is breathing into your pelvic bowl, which I used in that 5-day pelvic health challenge, was one of the days. So breathe into your pelvic bowl. They say breathe into your ribs, doesn't always cut it. You're still not breathing deep enough. So I want them, as we inhale, remember our pelvic floor is supposed to soften. So if you're breathing that deep down and like you're trying to, in your mind, push your pelvic floor down because there's so much air coming in, you're likely to get a more diaphragmatic like breath. And then proper engagement with the exhalation, proper abdominal engagement with the exhalation. We'll practice this. All right, and I think that's where we're at. So I'm just gonna pause the share. Okay, and this is where I had trouble earlier, because as soon as I stop sharing, we'll get to this in a minute. I lose my PowerPoint. So let me just get that prepped. Oops, that's not where it would be. And then we'll go through these couple of things. Hang tight for a moment. And if you have any questions, please unmute or type them in the chat. I'm going to make sure I'm going to be able to share. No one's doing that. All right. Okay, so here we go. don't know what is happening. Okay. Oh, I have two windows open. Here we go. All right, let me bring this one up here. Okay. So we're going to practice. First thing we're going to do is a 360 breath. So this is commonly called a umbrella breath, or it's really a diaphragmatic breath. So I'm going to stand up. Feel free to turn on your cameras and follow along. And if I can see good, I can give you feedback. But the 360 breath is imagining that you're expanding in all angles, like an umbrella. As you inhale, everything opens. As you exhale, everything closes. So the way I like clients to do it is just first start with your hands on your ribs. And as you inhale, and this is completely safe to do while you're pregnant. There's no reason moms should not be doing this when they're pregnant. But you want to feel that your ribs are coming out. Okay, so inhale. You saw that very clear movement, and exhale down. Okay, now the stomach part is a little lower. So I want you to watch kind of where my hand is in relation to the surfboard. Okay, so as I inhale, so it's moving. Okay, it's good to do that comparison, that looking, lining up, and just comparing, am I moving in relation to the background I'm at? Okay, so now my back. This sometimes is the hard one. Can I get my back to move and expand? So watch my hands on that surfboard. See that little yellow line? Hopefully I can hit it. And I just about did. I think so. I'll do one more. Okay, so having all that movement down here, I have some tension up here because I'm putting my arms up. But if I do it without my arms up, notice there's not a whole lot changing up here. Okay. Awesome. I see Sarah. I can't quite see your video well enough, but practicing along with me is great. So I want to show more of this. So what if I am trying to do a diaphragmatic breath, but I'm doing a shallow breath with it. So a plain old shallow breath often looks like this. And watch my shoulder over here. The surfboard's a really good reference. And then watch my neck. So my shoulders went what way?
Up.
Going up. They should not be going up. They should be staying right where they are. So now if I don't do that shallow breath, nothing really happened here. Maybe a little budge, but you saw a lot more of the expansion down here. And this is why we call it, like I envision a jellyfish or an umbrella, something opening. Okay, so that's the 360 breath and paradoxical breath. So how would that be combined? Like I think I'm doing a diaphragmatic breath, but I'm also still getting this, I'm sorry, I said paradoxical. I meant shallow breathing pattern. So it might look like this. So I'll put my hands here so you can see I still have movement down here. The giveaway is usually right in this area. Like you can see all that tension, okay? We want to keep that away. That's another thing, because I think both of you are pregnant. And any other pregnant moms watching, during labor, if whoever your labor partner is can just see, if you start noticing a lot of tension around here with my breathing, can you tell me? Because that's a sign that you're not doing your diaphragmatic deep belly breathing that's going to be productive in getting baby out. You're now doing a shallow breathing pattern that's not activating your sympathetic nervous system, going in the direction you don't want to go when you're in labor. Okay, let me try the paradoxical breathing. I sometimes have trouble getting this right because it's so out of me now. But basically what will happen is kind of the sucking in of the belly. So when I inhale, I should have a gentle coming out of my stomach. I'm exaggerating a little so you can see it more clearly. And then when I exhale, okay, now paradoxical, what I might see is this. Okay, so when I inhale, it's kind of doing that like sucking inhale thing, and you see more of this like vacuum space. I've had pants on today, so you're not gonna be able to see it, but you get more of like this vacuum, or sometimes down by the pubic bone, you'll see this like sucking in, and they're inhaling those. So when we're inhaling, we shouldn't be adding pressure by sucking in. We should be giving that pressure somewhere to go. So this is paradoxical. And then the exhale is more of this protruding out, bulging out, which can further a diastasis and not help healing of diastasis. With that demonstration, I was being very exaggerating. It can be a lot more subtle than that. But I think the easiest trick is making sure that you're not trying to suck in your gut when you inhale. That is not productive, and you should try to eliminate that from your breathing patterns. Okay, what else did I want to do right now? Yes. So we're going to go through the guided pelvic floor awareness. So I should have said this at the beginning, and I meant to, but if you can have something that you're sitting on, that is helpful. You're going to put this between your legs, so your vulva is resting on here. All right, and that just gives you more awareness to the softening and lifting of your pelvic floor. All right, so let's just dive into this. I'm going to try to make this into just a segment of this that I can post onto the Facebook page. So if you want to keep coming back to it, you can. All right, so I want you to sit comfortably on a rolled hand towel. So this towel I will show you is like this size, okay? You can also sit on like a folded up t-shirt, a small pillow. Sometimes people will do yoga bricks. I think that's a little intense. I think it should be something a little softer. Because if it's too rigid, you're not gonna really feel, you may not feel it. Okay, so make sure you're sitting on your sit bones. You're not slouching. If you're slouching down, you're not on your sit bones, and your weight is not through your vulva, and you're not gonna notice. So when we're up on our sit bones, our weight is more through our vulva rather than back by our anus. Okay, so you're sitting tall, feet flat on the floor. Gently close your eyes and begin breathing comfortably in and out through your nose. Throughout this awareness exercise, I want you to observe what is happening rather than doing it right. Keenly observe what your body is doing. The more you know about what your body is doing, the better you can identify even small places where it's not doing exactly what it should. If you jump and think, oh, I'm doing it right, and stop keenly observing, there may be elements of error that you haven't observed yet. And now you're just thinking you're doing everything right. So I want you to really keenly observe what's happening, even if what's happening is not what I'm telling you to do or saying should have happened. There will be time for change and improvement later. Right now is for observation of your current breathing state. So let's start by observing the movement of your ribs. What do your ribs do when you inhale? And what do your ribs do when you exhale? Place your hands on your ribs at your bra line, especially if you're having difficulty noticing what's happening. As you inhale, you should feel your ribs expanding. And as you exhale, you should be feeling your ribs contracting inward. Take a few more breaths, observing that movement. Now, focus on your abdomen. What happens when you inhale? Observing, not trying to make anything happen. And what happened when you exhaled? Place your hand on your abdomen to gain keener sense of the movements during the next couple breaths. Now for the pelvic floor. You're sitting on a towel to improve the movement feedback to your brain, just like when you place your hands on your ribs or abdomen. So with your next inhale, observe what happens. see if you can notice any shift or change in pressure through your pelvic floor. And then with your exhale, observe what happens. Do you feel any shifting or changing in pressure through your pelvic floor? Take several more rounds of breath to observe. Whatever you're observing is good. It's right. You need to know what you're doing to make any changes. So let's bring it all together. For the next few breaths, I want you to tune into the connected movements between your ribs, abdomen, and pelvic floor. Observe what happens when you inhale, what changes and shifts occur. And then observe what happens with your exhale, what changes and shifts in pressure and tension do you notice? Ideally, you should be observing when you inhale that your ribs widen, your abdomen expands, and your pelvic floor softens downward toward the towel. And when you exhale, your ribs drop down or come in, your abdomen contracts in, and your pelvic floor loses some of the pressure off of the towel because it's elevating slightly. Take a few more breaths and try tune into that system. If you're not feeling what I'm saying, it doesn't mean you're doing this all wrong. It's possible, but it's a little more likely that your brain is figuring out the signals that you're trying to tune into. Your awareness to the subtle movements will evolve the more you practice. Keep practicing. Keep observing instead of making things happen. Once you are thoroughly observing and have identified, I think that's wrong, you can make a shift and see if that feels more like what I'm saying it should feel like. This should be a daily practice until you can tune into the subtle movements between your ribs, your abdomen, and your pelvic floor on your first breath. Without Kegling. There's never a Kegel involved with what we just did. So you can open your eyes now. I'd love to know how that went, if you want to pop any comments in the chat. But this leads us to our talk about Kegling, because some and many times moms or clients will say, oh, well, if I do a Kegel, I can feel it and understand it. And I say, no, this is an awareness exercise. And this is really important in postpartum because so much has happened with your body that you lose awareness of the system. So we need to tune into it without messing with it, without trying to make anything specific happen before we can successfully start returning to more complex movements or engagement of specific muscles, which is what a Kegel is. So I'll get off my soapbox there. Let me try resharing my screen. I hope this works. Okay. So earlier today when I was trying this, it was not working. Okay. So, cool. All right. So Kegels. Overdone and overemphasized is my thought on it. Kegels are not for everyone. They are for some people. They're very important. How often and how many should be done varies widely, from never ever do a Kegel to you should do 3 sets of 10 every day or more than that. It's very variable widely from woman to woman, and it can also vary depending on where you are in your stage of life. Pre-pregnancy, postpartum, 20 years postpartum, it can change. So doing 3 sets of 10 Kegels every day through your whole life is probably not the ideal exercise. And I like to compare it to like bicep curls. Like, do you need to do 3 sets of 10 bicep curls every day for your whole life? No, it's not a reasonable recommendation that I've ever heard made, yet women are being told to do however many sets of Kegels. Now, I will say, and I don't have it written on this slide, but I will say, okay, so you might be wondering, well, how do I know if I'm someone who should do Kegels? I go back to symptoms. So those screenings I suggested last week, definitely going through the screening that I posted in the Facebook group and seeing if you have any red flags there. If you have any red flags, I would say, maybe not. If you have any symptoms, functional symptoms, you may not want to do Kegels unless you are assessed. Now, if you have nothing going on, you're like, I feel fine. I don't think I have any pelvic floor issues. When I do Kegels, it feels good. I think it's helping me stay strong. Okay, go ahead. But make sure you're linking it with this breathing system correctly. So I'm going to adjust my camera a little bit. So lift into a Kegel, the contraction, with your exhale, and completely release and relax the Kegel with your inhale. So exhale, we're lifting, which makes sense. That's what's happening with your pelvic floor. It's lifting with the exhale. Completely release and do what's called a reverse Kegel with your inhale. So some checks that you're doing a Kegel correctly. You should have no movement in your abdomen or butt. No one looking at you should ever know you're doing a Kegel, because it should be completely internal. There should be no movement. Your breathing is deep into your pelvic bowl. It's not shallow. And doing kind of mixing up the way you do Kegels, I think is really important. So you could do endurance holds. You're doing maybe 10 reps, but you're holding through a round of breaths. So you exhale, Kegel, and then you're breathing as you hold for 10 to 30 seconds. And then you inhale and release. Elevators is through one long exhale. You're kind of up, 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 lift, lift, lift. And long inhale, relax, relax, relax down. And then quick flips, just up, quick twitches. Boop, 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 boop. But you want those to be strong as well. So you want to make sure they're the same strength. So sometimes to get that same strength, you can't go too fast. And these are all things that I assess with my pelvic floor screenings, postpartum pelvic health screenings, and in any pelvic floor evaluation. So also consider variation. So postpartum, you're like, I feel fine. I just want to make sure things are working down there. And Hillary did recommend doing Kegels early on. You want to start laying down, because the more gravity you have weighing down on your pelvic floor, the harder it's going to be to do a Kegel. So laying down, to recline, to sitting, to standing, to moving. And at the bottom, I write, when in doubt, seek out help, feedback on how you're doing, what you're doing. The most foolproof way is through an in-person assessment of how your Kegel is. All right, if there's more questions about Kegels, I'm happy to answer them. But we're gonna go on to posture and alignment. So the way we hold ourselves through daily activity and movement directly influences our breathing and pressure system by optimizing it or impairing it. So if we think about mountain posture, like I'm doing in this photo, versus slouching. How do we breathe when we slouch? We're probably not breathing as deeply. Versus when we bend over, it's hard to breathe when we bend over. But then if we return up to what I would call functional mountain, then we can take a nice deep breath again. Lifting, computer work, breastfeeding. So just considering these positions and can we optimize the posture and alignment? We're going to go into more like specific examples like this in the Mama Ergonomics session. But this is you need this background information to apply it to all those movements. So this is how this course kind of builds on each week. So barriers to a neutral posture. I don't know if I would call them barriers, but common errors or blind spots that people don't know they're doing that make it hard to achieve and maintain neutral posture. So hanging on your skeleton or we're using your muscles. So ideally, we're using our muscles to hold ourselves up, not our skeleton. If we are, so right now I'm sitting, I'm using my muscles right now to sit up. If I'm just going to use my skeleton, this is where I am. Like, drastic difference, right? Because I'm just hanging on my bones. We have a lot of muscles that push bones apart between our ribs and between each vertebrae. That push us apart and hold us much taller. So we should be using those muscles. And that's why I love mountain posture so much, because that's what it's all about, like using your muscles to gain an ideal neutral alignment. We also need to be more aware of where our natural tendencies are for posture. Like, are you someone that tends to hold your neck forward or tends to really hold it back? Do you tend to have more rounded, or do you tend to have more tense back shoulders? Do you hold tension in your core? Do you keep your core really loose? What's your pelvis doing? We're going to go into that next. Do you butt clench, or your glutes completely shut off? Like, you're not hardly using them through your standing. Do you lock out your knees? That's a big one for me. Locking out your knees means you're hanging on your skeleton, means you're not using your muscles. How are your feet? How's that base of support? All these considerations. We can get very technical, and physical therapists do get very technical with this and kind of geek out on all this postural stuff. But for anyone, just having some better basic knowledge is going to be helpful in you being able to better correct your posture. Someone says stand up straight, you don't really know what to do. You may be standing up straight and making a lot of errors. I always think of the traditional kind of soldier stance. It's very stiff, and you would think, oh, they have great posture, but actually it's not aligned at all, and it's certainly not neutral. It's more an extension. So this is a visual I would draw a lot for clients. Just the side view being like, okay, your ears over your shoulders, over your ribs, over your hips, over your knees, over your ankles, and just straight alignment. And these are some of the cues, and we'll go through this together outside of the slides, but I wanted to share that. I did this a million times. Okay, so anteriorly versus posteriorly tilted pelvis. Super common. I think as we go through our day, no one stays in a neutral pelvis all the time, but the key is knowing, where do I tend to go? Most people have a tendency to shift more anterior or shift more posterior. And I'm going through here kind of demonstrate, okay, so I'm holding my pelvis in an anterior tilt. The way I can tell by this photo is my ASIS, that sticky outy bone, is right here, and my pubic bone's back here. Okay, so they are not aligned. They are tilted forward. The pelvis, so if I hold the pelvis here, whoopsie, organs inside, falling everywhere. So this is neutral. So this pelvis is more tilted forward, and on the other side, it's more tilted back. So with an anterior tilted pelvis, you get this more sway back. That's another way to see it. The abdomen is often softer, and this definitely puts more pressure on a diastasis. And knees tend to be more locked. Whereas the posterior, where my hip bone is here and my pubic bone is a little more forward, you tend to get more of this flat butt appearance. The abdomen tends to be more like clenched and tight. Like, sometimes you see this over, like, a lot of tone, muscle tone in the abdomen, and moms will think like, oh, my core is great. But I'm thinking, oh, but your pelvis is not great. And over time, yeah, you're 6 weeks postpartum and you're great, you have great core definition, but your pelvis is totally tilted wrong, which is putting you, one of the big risks of this posterior tilt is the bladder's kind of fallen off its ledge, and you start exercising and running and returning to this or doing movements in this posterior tilt, you're at higher risk for prolapse and incontinence and pain. And anterior tilt has its own risks with the pelvic floor. And then knees are soft. Sometimes these moms will say like, oh, I really can't it's really hard to straighten my knees. And that's another sign that they're probably posterior tilting, although everyone has their own. idiosyncrasies. Because I certainly recently had a mom that was here, anterior tilted, but she had trouble straightening her knees. So it can go all directions. So then let's look, so neutral pelvis is when these ASIS bones and the pubic bone are in line. Okay, and everything is just stacking better and more anatomically correct when we're in that posture. All right, when we are using our muscles to hold ourselves up and in neutral alignment from head to toe, pressures are more even. I'm not going to say they're ideal, depends on your breathing. Deep breathing is easier and internal organs are better supported and aligned. So let's practice. Stop share mode. So what we're going to practice here, I don't have my phone, it was just on that slide. I don't know why I keep losing my slide deck. All right, bear with me another moment. So we're going to go through mountain posture, and I'm going to demonstrate that neutral pelvis alignment. Give me a moment just to bring up my little cheat sheet. Okay. Here it is. Music keep going away. Okay, let me just scoot over. Okay, so neutral hip alignment, that was the first thing I went into. And then we're gonna go through mountain posture and then kind of putting it together. So I think it's great if you stand up and kind of follow along with me, trying this on yourself. So I'm gonna tilt it down so you can see better. Okay, I don't need to hold my, oh, it's not staying. There we go. Okay, so neutral pelvis. One of the best ways to do this is if you have something flat. It could be a book, I have a clipboard right here. Okay, so my pubic bone's here, my hip bones are here. Now, depending on how much, if you're pregnant, it's hard to do because you have a big belly coming out, so you can't quite do this trick. This is for my postpartum moms. So my hip bone's here and my pubic bone's there, and we're flat. Okay, so this is, I would be hitting the wall at the same time. Right now, I have flesh, like my mom's pubis sticks out a lot, so it's not perfectly aligned, but it is on the same plane. All right. Now, if I tuck my tailbone and I posterior tilt, the clipboard just shifted. It went back a little. Okay. So this is that posterior tilt. This is common with moms holding children too, because it gets the hip bone out more. And they kind of tuck, and they might clench their glutes more, which is causing more pressure through and tension through the pelvic floor. Or they might lose their glutes too. They're kind of like, where did my butt go? And they get this flat back. Okay, and my knees, if you watch, so I went from neutral, notice my knees, like I can't really walk them out. Okay, so they stay more bent, and that shortens your hip flexors. You get all these imbalances happening in the pelvic, in the lower body. Okay, now anterior tilt is this sway back. This is kind of what happens with pregnancy. Notice my pubic bone just totally left this clipboard. Like it's not there anymore. All right, so it's tilted forward. The clipboard or a book or anything flat is really helped to kind of help you notice that change. It's really common in pregnancy because you have the big belly. It puts a lot of pressure on your low back, puts more pressure on your abdomen too. And the tendency is to hang more on your bones because your knees lock out. Okay, so this is neutral. And when I go to that anterior tilt, what happens? So I trained myself out of it. I had an anterior tilt when I was younger, trained myself out of it because of back pain. And I overcompensated and I became a posterior tilt through pregnancy. So I was like, oh, I don't want to have a back pain. And so it made more space in my back, but I kind of lost my glutes and wasn't as engaged and aware of my core. And I thought my core was great when it really was not. Okay, so how'd that go for you guys on the call? That thumbs up, makes sense, find it, do you feel where you're at? And just pop it in the chat if you want, or if you had any questions. Okay, so now mountain posture. I'm gonna run you through my cues. I think it's better if you can see my face, so I'm gonna tilt up a little. You're not gonna be able to see all of me. But I do want you to start with your feet. So your feet, I like to go in bottom up. So the cues are as you're coming through the feet. So you want them to be hip distance apart. So put your knuckles together like this. This is hip distance. That's the space between your feet. Make sure they are pointed straight ahead. Really common to turn out. Make sure they're pointed straight ahead as if you're skiing. You want to cross those skis. You can't ski like this. You can ski like that, parallel. All right? And then the other common thing that happens through pregnancy is we tend to lean more into our toes. We have more weight here. Push this forward. Make sure your weight's back on your heels. Your toes are still in contact with the floor. So big toe is a key one. When you push your big toe into the floor, it kind of helps connect to your core. And you might notice that. Lift your big toe up, now push it down. Do you feel any like core, not contraction, but just kind of awareness when you do that? You may not today, but you do it 10 more times, you may start feeling that. It's a great connection. Okay, so then I go to my knees. And make sure my knees are not locked, they're not bent, they're just neutral. So if you don't have hyperextended joints, it's pretty much straight. It's going to be straight, okay, but not quite locked out. Just barely out of that locked position. And then let's get the booty going. Okay, so you're going to draw your kneecaps outward. And as you do that, as you'll see here, watch my butt. So as this is, I'm not drawing my kneecaps out. I know I did, whoop, you see your butt just this time, your glutes activate. Great exercise for early postpartum to get those glutes strong and during pregnancy. I'm not doing any movement. I may be standing at the sink washing some dishes, but I pull my kneecaps out and my glutes go. Okay, great little trick, but really good for keeping strong butt. And when you have a strong butt, it protects your butt. All right, so then we check in with the hips and check in my neutral here. I am. So now I'm going to inhale and I'm going to grow tall. So I want you to kind of compare where my shoulder is right now in comparison maybe to that black line. Okay, so if I'm just hanging out here, my lower body is great. I'm just hanging out. Now I inhale. Let me grow. Okay, so now I'm using the muscles in my spine to pull me up. And as I exhale, I don't want to lose that distance. So I don't want to come back and go. All right, I want to grow tall with the inhale. Letting my stomach come out a little as needed. And exhale, engaging my core with that exhale, holding. All right, little rounding of the shoulders. Don't over-exaggerate this. So sometimes we tend to be pulled here, computer, baby, whatever it is. And so you'll get straight and you're still kind of rounded forward here. And moms will use like big shoulder pops or chest pops. This is too much. This is overly tense through the shoulders. And we're arching your back now, so you're using your natural curves. Right? So we just want a gentle correction. Okay? Growing tall. And then last thing is ears over shoulder. Okay, so if my neck is out too far, my ears are not over my shoulder. If it's back, it's not over my shoulder. So ears over shoulder, over hips, over knees, over ankles. And I keep cycling through this over and over, okay? I thought it took a while as explaining it, but now I'll go through it quicker. So hip width feet, parallel, toes in contact with the floor, but my weight's more in my heels. Knees are not locked. Pulling out, glutes engaged, pelvis neutral, grow tall, fix the shoulders, and align the head. And you can rotate your hands forward, or you can just be in a more natural, call this like a functional mountain posture. Just aligning yourself as you're waiting in line at the grocery store. Okay? Just growing up, standing tall, using your posture, using your muscles. Never a bad thing. We can't do it enough. So if you go to this a couple times a day, this is impacting your pelvic health and in early postpartum, your body standing. So you may as well be standing, using and starting to strengthen those muscles, especially the core, and reconnecting to the core. So that leads me to the last thing. Okay, once you get here, kind of integrating, doing that awareness. So as I breathe here, making sure I'm breathing into my ribs and into my abdomen, and possibly, although it's hard when we're standing because our pelvic floor is just floating, there's no feedback, noticing any subtle lifting and lowering of the pelvic floor. So let's find our good mountain postures. Inhale, and exhale. And great, I can see right now my shoulders are not lifting or lowering, meaning I'm not having a shallow breathing pattern, and I can feel my core expanding slightly with my inhale, and my exhale, I feel it engaging. All right, so that is about it. I'm over time, I realize. Let me quickly share screen again if this wants to work. I have no idea. Okay, I think it's working. Let me pop into presentation mode again. And we'll finish up. So kind of the things that I would hope you're focusing on this week. So I'm gonna go to the bottom one first. This is my fun challenge. Extra learning opportunity, whoever is willing to participate in this, it will be great for everyone. So posting a photo or a video of yourself in the Facebook group for feedback. So maybe posting a video of, hey, this is how I normally stand, and I think I stand in an anterior pelvic tilt. This is me trying to correct it. Am I in a neutral? Kind of comparison photos are great, or a video of you aligning into mountain posture, whatever you want that relates to the session, watching you doing a breath. I think it's a great learning opportunity for others to see, hey, this is how I was doing. If you have a comparison, oh, this is how I was doing it before I talked to Hillary, saw Hillary explain it. Look at my breathing here. Now look, I just tried to fix it, and I can give you feedback as well of if you got it right, which you probably do. I hope you do, or if there's still a few more tweaks to try. Don't have to do that, but what I do think, trying to pick out one or two things that feel new or unfamiliar to you from this week. Is it the jaw relaxation? Never done that, and you always have a lot of jaw tension. Incorporate that into your day a few times. Is it pelvic floor awareness? The 360 breath? I don't even think I did the 1 to 2 breath. That I will post on the Facebook group, so we're going to talk about that. Is it neutral pelvic alignment, mountain posture, whatever it is? Whatever you land on, set a specific goal. So for example, I will complete the pelvic floor awareness exercise 3 times this week in the evening around 8:30 or 9. When we set goals like this, it's more likely we're going to do them. Or another goal might be, I will practice returning to neutral pelvic alignment 1 to 3 times while I cook dinner each night this week. So incorporating it into your routines. I think that is ideal. All right, and I am going to stop the recording. I'll take any questions from those on the call. Let me stop this recording. Thank you so much for watching, and hop on over to the Facebook group for that 1 to 2 breath.